Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
Good evening, everyone. In the midst of all these hurricanes and everything, we are ready to have some discussion this evening regarding all that and see what the Red Cross can do about it. So I'm your host, Ed McQueen. Of course, our co-host, Miss April Garner Davis. And we're here this evening to kind of shed some light on the current weather conditions and what strategies are being used by, for example, relief organizations like the Red Cross, for example, and what can be done, how it's implemented in the event that it impacts us, and that's we never forget that. So anyway, April, without further ado, I think we can so that we can get the best of this hour that we have in front of us to talk about these. I'm about to use the word life-saving information, but it still may be the case. Would you like to introduce our guest?
Well, we have with us this evening Mandy McMahon, who is with the American Red Cross, and she is going to talk to us about the disaster relief efforts that are happening now, that are focused on the communities impacted by Hurricane Helene. And so we'll allow Mandy to introduce herself. So Mandy, how are you this evening?
I'm well. Thank you so much for having me on your show. We appreciate the chance to talk about Red Cross response and how people can protect themselves as we potentially face another disaster hitting the Southeast here.
Absolutely. This is a very appropriate and timely broadcast this evening, especially with the fact that Hurricane Milton is just on the brink of impacting Florida and the Tampa Bay area and surrounding areas. And so it's good to know that there is an organization like the American Red Cross that can provide disaster relief aid to communities. And I imagine that is across the country. And so why don't you tell the audience a little bit about yourself and how long you've worked with the Red Cross, and also what led you to work with this wonderful organization?
Yeah, thank you for the opportunity. So I've been at the Red Cross about 4 years as staff, and before that I was a volunteer myself. So you probably know Red Cross is a volunteer-led organization. About 70 or 90% of our workforce is volunteer-led. So that was my first introduction. I was also a lifeguard for 4 years, and I've been an avid blood donor. I've given over 10 gallons of blood. So that's where my passion for the Red Cross comes from. Over the past 4 years being with this organization, I've had the opportunity to now deploy to 3 of our largest national disasters, one being Hurricane Ian in 2022, the Maui wildfires in Hawaii last year, and now, of course, Hurricane Helene that's impacted 5 states across the Southeast. But my role is as the communications director for South Carolina. I work to educate the public on how they can access Red Cross services, how we're present in the community, and the different ways that they can engage with our mission and support our humanitarian and life-saving mission.
So with the fact that we are facing some serious storms this year, as you mentioned, Helene, and I'm glad that you mentioned the fact that it's more than just hurricane relief efforts, but other types of disastrous occurrences that impact communities. Can you talk a little bit about the relief efforts and how the Red Cross plays a role? What exactly does the Red Cross do for communities?
Yeah, and you're so right, April. It's more than just disasters. So we say that we're here for people in any time of emergency, whether that's a medical need that requires life-saving blood, or teaching life-saving skills such as CPR and AED and first aid. But the thing that people think of most often when they think about the Red Cross is certainly folks in red vests who put those on in times of disaster, and they're in communities providing relief to people whose lives have been upended. It doesn't, it doesn't matter how much you prepare, like having a disaster is always devastating. And it's even more so when people are faced with this back-to-back type of assaults on their lives. So we've been seeing that more and more over the years as the climate crisis has only gotten worse. We're seeing more and more extreme weather, more frequent extreme weather, like we're experiencing here in the Southeast right now. So that's what the Red Cross is working hard to do, is to educate the public, number one, about preparedness, but also to make people aware of the humanitarian impacts of the climate crisis. So that's what we're working hard to do in those times in between disasters, although now we consider ourselves not in a state of disaster response, but in continuous response. So that's what the Red Cross is facing at this time. And as we're seeing it really on a really grand scale now, as people are still picking up the pieces. In fact, there's been some accelerated timelines on trying to get people's debris picked up so it doesn't become even more dangerous in the face of Milton. So that's what the Red Cross is working on. A lot of the teams that were on the ground responding to Helene in Florida specifically are still there, and now they're transitioning to supporting Milton.
So I don't know if you are prepared to provide us any stats or anything, but as we think about the most recent catastrophic event, which was Hurricane Helene, do you know how much aid has been given to residents in Western North Carolina, and the death toll or any other types of stats that can put it in perspective as far as what the Red Cross has to deal with whenever you go into communities that are impacted by these natural disasters?
Absolutely, yeah. So the Red Cross has been on the ground across the Southeast up to a week before Hurricane Helene really devastated these communities. And to date, we have over 2,000 Red Crossers on the ground that are providing safe shelter, supporting families through all different kinds of needs that they may have. So we have drivers delivering mobile feeding out into communities that are hard hit that might not be able to make it into our shelters. We also have teams of folks that are supporting individuals' other needs besides their housing. So as you can imagine, disasters are incredibly traumatizing to people. So we have mental and spiritual care providers who are highly skilled and trained individuals that are capable and equipped and skilled in providing for the mental and emotional needs of our people who've been impacted. We also have health services individuals who are helping to replace durable medical equipment. So prescription eyeglasses, refilling prescriptions. In fact, in Western North Carolina, we have a really cool story from one of our shelters that had a very high veteran population. I think there's about 60 veterans in this shelter, and they were trying to figure out how they could get transportation to the nearest VA hospital. The Red Cross was able to facilitate bringing doctors from the VA to the shelter. And to date, they've already filled over 100 prescriptions for these individuals. So we're caring for the whole individual, but it takes a lot. It takes a lot of manpower. It takes a lot of resources. And as we've all been hearing and seeing in the news, these areas are highly inaccessible. There's been so much damage and so much destruction that it's difficult to access a lot of these areas, but we're working as quickly as we can. And like I said, we have over 2,000 people on the ground that are doing their best to meet those needs. To date, we've provided over 30,000 overnight stays in our shelters. And we've also been feeding people, providing over 400,000 meals and snacks into the community. So that's just a little, a snapshot of how the Red Cross is supporting folks.
How is the Red Cross able to handle that type of capacity? I mean, 400,000 meals and 30,000 overnight stays, 2,000 boots on the ground. It sounds like a very massive effort to make sure that people still have the resources that they need after a disaster. How is all of this coordinated?
I'm impressed and inspired every day by the work of the Red Cross, and so much of this is planned. We've been preparing for this hurricane season. You might remember from months ago when NOAA was warning us that this was going to be a really overactive hurricane season. We knew that this was going to produce multiple significant hurricanes, And we've already seen it. Unfortunately, we had Hurricane Beryl. We now have the extreme rapid intensification of Milton. We have Helene, which I don't know if none of us expected a hurricane in the mountains, but here we are. But unfortunately, the Red Cross, we've been monitoring the situation. As I was saying, like we're now experiencing in the 20s a number of billion-dollar disasters that are impacting Americans every year. That number used to be in the tens. So we've doubled in the last 10 years. So it's a really significant situation, and the Red Cross has been preparing for this for a long time, both with our donors and with our workforce. So part of our readiness posture includes not only fundraising to cover the extreme cost of these disasters, but it's also the power of our volunteers that we're able to mobilize. That is a huge part of our readiness.
So your volunteer base, I know it has to be sometimes difficult to rally volunteers and to have enough volunteers to assist in these communities when disaster strikes. And yet I imagine that most people are driven by just the sheer, compassion and empathy that they have for people whenever they lose everything or they're, faced with these types of occurrences. And so as you work with your volunteers, tell us a little bit about what that volunteer profile looks like. I imagine that they probably come from a wide section of the community, and it's not one particular type of person that volunteers.
You're so right, April. One thing I can say that is true of all of our volunteers is their giving heart. Not a lot of people understand the commitment that it takes to deploy to disasters like this. I didn't even know myself before joining this organization, but our volunteers, they're volunteers. It's in the name. They're not getting paid, but they raise their hands to travel across country, sometimes multiple times, sometimes back to back for 2 weeks at a time, to be away from their families and to be in less than comfortable conditions. Our volunteers are sleeping in staff shelters. They're eating the same meals as the people that are staying in our shelters. So I take a lot of pride in that, knowing that we treat our people that are entrusting us with their care as well as we treat ourselves. So it's a really beautiful thing. And I get emotional talking to our volunteers, listening to their stories on why they choose to do this, because there's such beautiful souls that choose to give up this time to be away from their families in uncomfortable conditions. And they love it. They absolutely love it. And after I've deployed, I see that for myself. When I went to Hurricane Ian, it was an overwhelming, but an incredibly humbling experience. And I myself, much like our volunteers, you get addicted to it. You get addicted to the idea of helping people and being a part of the good amidst the sadness and devastation.
Mm-hmm. So I know that you mentioned as you were describing some of the types of catastrophes or disasters that the Red Cross actually covers, as well as things that aren't related to disaster relief. Can you kind of describe for us the different divisions of the Red Cross, if they exist? And, a lot of people associate it with, giving blood, and they see the Red Cross mobiles that come into the community. But exactly, how many different divisions or categories of assistance are there for the Red Cross?
Yeah, so we call it our 5 lines of service. So those being biomedical services like you talked about. So that's our blood collection side of things. So we supply about 40% of the nation's blood supply. The Red Cross is the single largest provider in the country. And we have a lot of really exciting initiatives going on as a part of that. So not only is the Red Cross providing life-saving blood, we're also on the forefront of innovation and making it a more inclusive process. So 2 years ago, the Red Cross launched our sickle cell initiative, specifically to raise awareness of sickle cell disease and also to encourage more Black and African Americans to give blood because they are most likely to be a compatible match for patients battling sickle cell. So this has become a huge initiative for us, and it's been highly successful. So we're partnering with organizations like the NAACP, Divine Nine, HBCUs to get out that message and to bring in more donors into the fold so that we can better care for patients battling sickle cell. We also have, did you have a question about that?
No, go ahead. I was going to say that's highly intentional, and that's great.
It is highly
Mhm.
intentional. And then we've also been supporting making the donation process more inclusive, particularly for individuals in the LGBTQ community. So the Red Cross worked with a couple of other blood collectors to do a new study called the Advanced Study that has made the blood donation process more inclusive. So everyone is now asked the exact same questions, regardless of your sexual orientation. So just a couple of the really cool projects that we have on our biomedical services side are really inspiring to me as a blood donor myself. We also have our service to armed forces. So this is the side of our business that takes care of military members, veterans, and their families. And within that, the most recognized program, I would say, is our emergency communication services. So when a service member deploys overseas and an emergency happens back home, the Red Cross is that mechanism that a family initiates a message to their service member. And then sometimes the Red Cross is able to facilitate their return home, whether it's for a sad occasion, such as the death of a loved one, or it might be a happy occasion, like the birth of a child.
Mhm.
We also have international services. So the Red Cross responds to international disasters as well. And we teach preparedness messaging around the world in other areas that are likely to be impacted by significant disasters. We also have our measles, mumps, and rubella initiative to provide vaccines in communities where those diseases are still very much prevalent and deadly. And then we have of course, our life-saving, our training services. So we train millions of people every year in life-saving skills such as CPR, AED, first aid, lifeguarding, swim lessons, all those types of things. And then what we're talking about today is our disaster services. What people don't realize is that certainly it's the big events like Helene and Milton that make the news, but more often than not, every day of the week, the Red Cross is responding to small single-family home fires. So here in South Carolina, we're responding to 6 home fires every day, and that is the
Wow.
bulk of our activity on the disaster services side every day of the week. And then right now, of course, we're focused on providing relief for people impacted by these large, significant national disasters.
So, it dawned on me since you were saying that you responded to number 5 and stuff like that. Do you have ambulatory equipment that um, that are readily available if you're in a far rural area of some forth, and your a typical um, fire and rescue people can't get to? Does the Red Cross act as a fill-in? Is there a void there that the Red Cross can fill in?
So more often than not, the Red Cross is actually called and dispatched by the fire department. So it's when the fire department responds, they know to call us. I mean, hopefully they know to call us, and then we're able to send out our volunteers to meet with that family and help them on their path to recovery. So typically that means some financial assistance uh, through those first hours and days after experiencing a home fire. So they might use it for a hotel stay. They might use it to replace clothes. So many times we hear stories of families who've been displaced by home fires and they didn't even have shoes on their feet. It was in the middle of the night and they were in their pajamas. So that's something that the Red Cross provides, and we do that as financial assistance so the family can choose for themselves what they need most in those moments. But then we also will maintain contact with the family for at least 30 days through our casework process, providing additional supplemental services. So it might be referrals to other agencies that can give them assistance in one area or another. Or it might be the mental and spiritual care that we talked about, or it might be the health services, so helping them to replace prescription eyeglasses, medications, things like that.
Yeah. One of the reasons why I asked about especially the ambulatory, because um, I've read, but I haven't experienced that. But I've read about they use the word inequality of service for people who are remotely located. I say remotely, way out in the rural areas. that's to me it's critical. Um, and I know the Red Cross, uh, um, you know, can do its part, but uh, to be a fill-in for a place that has least ambulatory access. Um, do you have strategies for making sure that if it's not occurring already, that it can be placed in be done in place so that it can occur?
I'm not familiar with that particular challenge. All I can say is what the Red Cross does, and we do work, with other larger coordinating agencies like South Carolina State Fire, who helps administer some of our programs. One is our Home Fire campaign, which seeks to install free smoke alarms in communities, particularly at risk of home fires, which we know based on historical data of where we've responded to home fires in the past. And unfortunately where there's been a significant number of home fire deaths. So the Red Cross will go out into blitzes, working with local fire departments and the state fire to install free smoke alarms, share home fire safety education, and help people create escape plans. So that's something that we do with one of those coordinating agencies.
Okay.
Well, Brother Edward, I was anticipating that you had another question, but if not, then
Well, yeah. I'm looking. I got this signal say that my volume is
your volume is very low. Mm-hmm.
very low. So I'm gonna have to try to correct that.
Okay. All right. Well, Mandy, there was a question, a question basically in the feed, but also, one of the questions that we were going to cover tonight involves what's happening in Horry County when it comes down to deaths associated with fire. And it was discussed at a recent Red Cross event that there have been a total of 45 deaths associated with fire. Is that number accurate? And what efforts are being made by the Red Cross to prevent some of these fatalities, if any?
Yeah, absolutely. There's a lot going on that we're doing to help prevent home fire fatalities. That is the home fire campaign that I had just spoke about. So the home fire campaign, it really looks at the historical data of where we've seen home fire deaths and a high concentration of home fires. So that data we look at with both state fire, but also our own response records. And then those are the communities that we target specifically with our smoke alarm blitzes through a campaign that we call Sound the Alarm. So every year we choose a city to particularly target and canvass. This past year it was Horry County. So we had numerous blitzes throughout the months of April and May, installing thousands of alarms. And we do that again in conjunction with the fire department and with state fire, and then our Red Cross volunteers to go out, physically knock on doors and chat with families about how smoke alarms save lives. So working smoke alarms cut the risk of death in half from a home fire. Mm-hmm. So we know that they work. The thing is people have to, of course, check them and replace the batteries when they're needed. A smoke alarm only has a life of about 10 years. So if you think about your own home, I know it's not always top of mind for myself, but you have to change your smoke alarm batteries. You have to test them. And if you've been in your home a long time, it might be time to replace your smoke alarms as well. But that's what the Red Cross does, is we go into communities, again, that are at high risk of home fires, have conversations with people in their homes, install these free smoke alarms, and give them the education to empower them so that we do see fewer deaths. Across South Carolina, since we launched the home fire campaign in 2014, we've saved over 140 lives. And we know this because of the data that we keep from our smoke alarm blitzes. So when we go into a community and we install smoke alarms in a home, we're keeping track of that. And then if we get a call to a home that had previously had that safety education or smoke alarm install, and they tell us that the smoke alarm alerted them to get out of the home, we count that as a life saved. So it's a really it's a really accurate system. The thing is we probably think that we've saved more than that number of lives because of the number of smoke alarms that have been installed. So it's a really impressive program that has demonstrably saved lives.
And I don't know if you have this statistic offhand or know from conversation, but how many elderly individuals are actually impacted by this initiative? Because I imagine that if there isn't an initiative like this in place through the Red Cross or even local fire departments, that a lot of elderly residents probably don't have the means or the resources to make sure that they're keeping up with active smoke detectors or any fire extinguishers or whatever that could help in terms of preventing fire fatality. So do you know how many elderly residents are assisted each year by this initiative?
I don't have that specific statistic. We break down our lives saved numbers by youths and adults.
Okay.
What I can tell you, though, is that we do have very specialized smoke alarms for people with different needs. So we have smoke alarms for people who are deaf and hard of hearing. They're actually called a bed shaker alarm. So those are a unit that we can install, again, alongside fire departments that will help alert somebody who has a disability as it relates to their hearing. So that is something that we do offer and provide for folks that have specific needs.
Okay, awesome. Well, we have also joining us tonight Priscilla Fuller, who is a volunteer for the Red Cross, and she is with us tonight. Hey, Priscilla, how are you?
I'm doing fine, thank you. Hi, everybody.
All right.
Hi, Mandy.
Awesome.
Thank you for being on.
Thank you, Priscilla, for the invitation. I appreciate it.
Yes, so Priscilla, as a volunteer for the Red Cross, I'm sure that you can share with us what it is like to be a volunteer and just kind of talk about how the community can support the initiatives that the Red Cross actually undergo each year.
Well, I think it's incredible, the whole experience of being a volunteer, because initially I wanted to do something in the community to give back to my community. And I was looking for various organizations. And the Red Cross has such a good reputation and they are in so many different fields. So I sort of launched onto them as a disaster worker. And I did that for 3 years. So basically, as Mandy was describing, when there's a fire or flood, no matter what time it is, we would go out and we would assist the family and provide certain services and resources. And, it's one of the things I think the experience sort of taught me is, again, being humble and being grateful for what you have. Because sometimes when we go in those areas and we would see people who have lost everything, their home, their trucks, their barns, and they have nothing. And they are so happy that you're there. And it doesn't matter, what color, what your political affiliation, they are happy that someone's there to assist them. And so it sort of taught me a lot, and it made me even more humble and be grateful for what we have. Because you meet a lot of people from different places, different experiences, and it is a wonderful thing to give back in the community. And it's good for people in the community see someone from the community working to assist people in the community with their issues. So for 3 years I did that, and then I got too old, and I've been working in the blood drives for the last 2 years, and I've enjoyed that tremendously because that's a big deal. When Mandy talks about the sickle cell new initiative, a lot of our community people, have that disease as well as cancer and other things, and they need blood. So it makes me feel good when I see people from our community come in to donate blood, as well as when people volunteer. It means a lot. And there's so many, there are 5 different divisions. So there's something for everybody. And you don't really even have to go to a site. There are jobs within the Red Cross that you can stay home and still do the job. So I think it's extremely important. And the Red Cross really have a good reputation, and they have not let me down. I really enjoy it. I look forward to it.
Well, I think that's awesome. It's an awesome testimonial, and it does take just a lot of compassion to be able to do this as a volunteer, especially since you essentially are there to help, but you could also put yourself kind of in the line of danger sometimes. Even though you're kind of there in an official capacity, and so that takes a lot of integrity and just dedication to making sure that people are safe in order to, even stand up and say, hey, I will volunteer. So, Mandy, if someone wants to volunteer, how do they sign up? Where do they go? What do they do?
Yeah, the Red Cross has volunteer opportunities for literally any skill set. I remember when I first joined here as the communications director, being disappointed that when I was in college, I didn't understand that there would be opportunities to send press releases for the Red Cross, for example. So no matter your skill set, there is something you can do, and we will train you. It's all free, just like what you were describing too, April. I wanted to mention all of our volunteers that are working with people who've experienced a disaster are given what we call psychological first aid. So it helps them to better approach the people who've been impacted in a very sensitive and thoughtful and intentional way. But going back to your question, we have needs for people to respond to daily home fires that are out in those rural communities, like Mr. McQueen was talking about. So we need folks that are available, day and night. Our volunteers will dispatch in the middle of the night to go out to a home fire. We need folks to deliver that life-saving blood from the blood drive to our lab, where it gets tested and processed and then deemed safe for transfusion to a patient in need. So there's any number of opportunities you could help with the case processes that I talked about with our service to armed forces. So whatever your passion is, the Red Cross can find a good spot for you. We even have a tool on our website at redcross.org/volunteer that can help. It's a little quiz that will help you find the right opportunity for you.
So now I imagine that, in the Carolinas, there is a concerted effort to make sure that the residents in Western North Carolina are receiving the resources and supplies that they need. Can you give us a bit of a profile of what the Red Cross has done for that community? And then also, I think you provided a link that I'm going to share with everyone should they want to assist or donate or whatever the case is. So I'll put that on the screen if you will tell us a little bit about what's going on in Western North Carolina, what the major needs are.
Yeah, so the needs are similar across the entire footprint of the disaster, but particularly in North Carolina, there's especially a need for reunification. So many people were separated from their families, or maybe their family across the country hasn't heard from them because there was no connectivity. There was no cell service for over a week in that area. So the Red Cross created a website at redcross.org/Helene, where folks can input the information about their missing loved one. And then the Red Cross has a team of people who are out doing research, essentially as investigators trying to locate those folks. So they're cross-referencing our shelter list. They're calling local hospitals. In some cases, they might be going to visit the last place that the person was known to be. So that's been a really large need, a very sad situation for what's become a mass casualty event, is the need for reunification of families to reconnect with loved ones.
Okay. And so there it is, redcross.org/Helene. Please share this website link with others so that, you can help with this effort to reunify families. And, I just can't imagine what the residents in that area are going through. And, you hear of, the cities that were impacted in such a major way. Asheville, Chimney Rock, Boone, and it's like, wow, if you've ever visited those places, it's really hard to imagine that there's the amount of catastrophe that has happened there. And so I can, I hope that. Well, I already know that communities are actually coming together to send the much needed supplies, and I'm sure that travel is still, near impossible to get there. And so everyone, I want to put this out there: just be safe in what it is that you're trying to do to assist the residents in Western North Carolina. And one of the ways to do that is to connect with an organization like the Red Cross so that they can give you the proper directions on what to do, or even, you can collaborate with the Red Cross in order to make sure that the help that's needed is given in a proper and a safe way. So, Mandy, thank you for, that update about what's going on in the Carolinas. And so as we look forward to what is going to be happening in just a matter of maybe 48 hours with Hurricane Milton, what is the American Red Cross doing to prepare for what we know is going to occur as a result of that hurricane?
Yeah, so in Florida specifically, we have or will be opening evacuation shelters for people escaping the storm, and so they can ride out the storm in a safe place. Like I said, so many of our teams that were there for Helene have now, they're being readjusted to not so much recovery, but rather evacuation for the folks who are in the line for Milton. So the Red Cross has been monitoring this. We unfortunately knew that there was more storms coming behind Helene, and that's what we've been readying for. So a lot of that involves us calling down our workforce, getting people lined up, checking their availability for days and weeks ahead, where we know that the first wave of volunteers are going to be coming up to return home, but we're going to need another wave of volunteers and another wave after that. So the Red Cross has been working hard to pre-position resources, to stock our warehouses, to pre-position cots and heater meals, so that we have all the resources we need on the ground in the wake of this storm. So we've been there, we're going to be there, and we'll be a part of the community's recovery as long as we're needed.
And that's wonderful. So you guys did something, Brother Edward?
Yeah, from this area, Mandy, how dependent are they on for resources? People in Florida, and what I know you detailed some of the things that you all are doing and what you can do. What about the human resources? What would they do if they were to go to this volunteer and go to Florida?
Yeah, so we're coming up on the window where we would have what we call a ground stop. So safety comes first for our workforce as well, as the people that we care for. So people that aren't pre-positioned now will be deployed as soon as it's safe to do so. But we have the resources on the ground that we need to shelter people evacuating. So that would be our primary focus in the immediacy of Milton, is evacuation shelters. So those aren't always stocked in the way that an emergency shelter is with cots and food and all that stuff. It's really for people to ride out the storm, and then they're converted after that for people who are permanently displaced from their homes.
Mm-hmm. So if I wanted to be a volunteer to go down there on a post basis after the hurricane is gone, do I go to my office right here in Myrtle Beach first?
Definitely. That's the first step, is to connect with your local chapter. You can also, like I said, get started at redcross.org/volunteer and apply. Again, as we talked about earlier, our volunteers are highly specialized. They're highly trained. And we require that because it takes a highly trained and highly skilled workforce to effectively care for people in this time of need. So we ask that people don't self-deploy to disasters like Western North Carolina or Florida. We really need and depend on skilled, trained volunteers. So there is a bit of a timeline before, after someone fills out the application to they're getting their background check confirmed, and then all of the training that's required before they're deployable. But the first step, like you said, Mr. McQueen, is to apply, to get started at your local chapter and to apply as a volunteer and get started on the process. And then we can help get you through there. And something else that's really impressive about the Red Cross is we have volunteers at every level of our operations. They're the frontline workers in our shelters. They're delivering food on the road, but they're also a part of the leadership and the management of the operation as well. So our volunteers are really a part of every level of our disaster response.
And I think the training is extremely important because you will utilize the trainings that they give you, and as well as in terms of how to assess the damage in various houses. And that's a skill that I think comes in handy in a lot of situations. The other thing, as Manny was saying, there's like government operations where, you're in the room with government and county people and you observing the situation surrounding the storm. And that's sort of like where the operations of the storm come from. So all of these are things that I think are very interesting, but it's also very important to manage the situation in the event of such a disaster. But I think it's very worthwhile for people to explore, really.
So Mandy, not as a follow-up on what Priscilla, but I think you all are very fortunate to have someone like Ms. Fuller as a volunteer. Her skills have been shown so far, and I think April can attest to that.
And it's not lost on us. It's not lost on us, the treasures that we have in volunteers like Priscilla. They are highly valued and treasured. And we thank Priscilla, and we thank those like her who give of their time to support others in our community. It truly makes our mission possible. Like I said, 90% of our workforce is powered by volunteers like Priscilla.
Mm-hmm. Fantastic. Well, Mandy and Priscilla, we thank you so much for being here this evening to talk about the work of the American Red Cross and to give us an overview of all of the things, the 5 areas that the Red Cross actually has in place to take care of various types of disasters or community needs that even aren't disaster related. And so continue to do the good work. Be safe while you're doing it. And yes, Priscilla, thank you for being an inspiration for volunteers in our community. If Priscilla can do it, we can all do it. I feel inspired. I'm like, wow, this is awesome. Yeah, this is awesome.
Very interesting. I think people would find it. In addition to meeting a lot of people from different places, military people from all different parts of the country, is really an experience that I love.
Mm-hmm.
Look, I'll say this to our listeners. I know we're about to close out here, but this is still hurricane season, I believe, for all over, right? South Carolina is not out of the woods yet.
No.
Okay, so I think this conversation that we're having now, sometimes I believe is priceless. Okay, because we're getting information that. Something like that.
I'm sorry, what were you saying, Brother Edward? You said we're getting information. Brother Edward.
You're saying getting information about the.
You said we're getting information, and then we didn't hear what else you said.
I said, I asked about the. Is my volume still low?
Yeah.
Yes. Yeah.
Volume. Wow. Okay. I asked about the. I was letting everybody know that this is that the hurricane season is still with us, right?
Right.
And South Carolina is not out of the woods yet. Okay.
That's true.
So this information that's being propagated out tonight, on this broadcast, certainly is could be deemed priceless, and as a preventable measure for what might still occur since we're still in that season.
Right.
So everybody should be aware.
Right.
About tonight's broadcast.
Thank you for having me on, getting me on finally. But I think it was something. Thank you.
Likewise, thank you all. I really appreciate it.
Thank you both.
Mandy.
Thank you both. Yes. So, Brother Edward, I have just a couple of community announcements, and then, of course, we'll talk about our guests for next week. There is a Project 2025 Session Part 2 that is happening Tuesday, October 22nd at Bethel AME Church, which is at 1530 Racepath Avenue in Conway. Food will be served. It's happening at 5:30 p.m. that evening. And I imagine if you want more information, you can contact the church. But this is a part 2 of what I imagine is a series that they put together to kind of create an understanding around what Project 2025 is all about, and especially since that seems to be a hot topic item during this political season. So I just want to let everyone know that if you're interested in finding out more about it, this event is happening Tuesday, October 22nd, 5:30 p.m. at Bethel AME Church. Also, the initiative that is, on the table through Santee Cooper and the Sustainability Institute to help you save money on your energy bills. There is a workshop that is happening Wednesday, October the 9th, which is tomorrow from 6 to 8 p.m. at the James R. Frazier Center. And as you recall, we had special guests Marilyn Hemingway and Mitch, I think his last name was pronounced Hoke, with the Sustainability Institute on our show several weeks ago. And they were talking about this new initiative to help you save money on your utility bill. So if you want to know more about that, to find out more about the resources and the tools that can help you to make sure that your utility bills are lowered, especially as we come out of the summer season and go into the winter season where utility bills can be particularly high as well. You'll want to go to the James R. Frazier Center on tomorrow night from 6 to 8 p.m. and learn more about how you can make your home more efficient. And so those are 2 community announcements that have come our way for this evening. And then also next week, we will have a special guest, Jada Hudson, who is with the Myrtle Beach Area Chamber of Commerce. She is the public policy coordinator for the chamber, and she is going to be with us to talk about the Ride for Ballot referendum that everyone will be able to vote on this coming election. So a referendum is basically a direct vote by the electorate, and it's a vote on a proposal, a law, or a political issue. And typically we see referendums on our ballots, and you have to take like a few minutes to read it and figure out what it is that you're voting on. I think, and I'm going to look into this. I'm sure that there's a way to get that information beforehand. I think it's best that people understand referendums and, special amendments and things like that are on ballots for you to vote for before you actually go to the polls. And so this is one way for everyone to understand the Ride For program, which of course that is rooted in the penny sales tax, with the revenue going towards fixing existing roads and making upgrades to roads. And so Jada Hudson will be with us next week to talk about the Ride For Ballot on the referendum, just to give us more information about what it is and what we need to know about it as we make our decisions on how to vote on that. And so just want to, let everyone know that we're going to have that great information on next week. And you can come on with your comments and questions about that particular RIDE program. I think there's several phases to the RIDE program, but we'll be talking about RIDE 4. So if you'd like to find out more about that before next week's show, you can go to fixoriroads.com. That's fixoriroads.com, and you can find out more information about the RIDE program. So Brother Edward, that's all I have for this evening, and I hope that everyone remains safe. Hope that everyone remains safe with this upcoming Hurricane Milton. It's no joke. Everyone needs to take it seriously who reside in the Florida area, especially Pinellas County and, down near Tampa Bay and all of that. I have some friends who actually evacuated from that area to, I would say, higher ground, so to say, in Florida. They went from the Tampa Bay area to Jacksonville, hoping to get away from the big brunt of the storm. But yeah, this is it's making meteorologists nervous. And so I think it's one that everyone really needs to pay attention to. And I don't know what the impacts will be in the Carolinas, but, typically we will experience something from it. I'm just glad that, this time around, it doesn't look like we're going to have the brunt of the hurricane much as in the same way that Florida will. I will say that there are 2 more hurricanes behind it.
Absolutely.
And so it's the MLK. There's Milton. I think it's Lester and Kirk, or Leslie and Kirk. Milton, Leslie, and Kirk. And so we need to keep an eye out on those 3 storm systems. And it's really interesting that these 3 storm systems are happening so quickly. And we can't say that, like you said earlier, that we're out of the woods. Western North Carolina, Hurricane Helene showed us that anything is possible. Anything is possible when it comes down to these types of weather systems. So everyone just stay vigilant, be safe. Now that you know about the Red Cross and what they're able to do, if you know of anyone who is in need of disaster relief, contact your local Red Cross and they will be able to deploy the authorized volunteers and resources to help people in need. So we'd like to thank all of you for being with us tonight. And thank you so much for watching. And again, share this broadcast because someone may need this important information. And we'll see you next week with our Ride 4 discussion. So everyone have a great evening.
They can go, they'll be able to see the recorded version of this.
They can go to wcmagazine.net. This will be available for the next week. And then also our YouTube page. It will always be on the YouTube page, even after a week from now. We always change out the broadcast every week for the new guests. But you can always find the broadcast in, I guess, a more perpetual way on our YouTube channel. So thank you all so much for joining us. We really do appreciate it.
Really.
All right. So take care, everyone.
Godspeed. See you next week.
Yes.
God willing.
Yes, absolutely. Take care.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.